Alright, so I'm getting a blood test today, and one of the things with checking blood is, or especially with regards to cortisol, cortisol is that hormone that looks for fatigue, sleep disorder, comes from the adrenal glands, and if you're stressed out, the adrenal glands will eventually stop or decrease their production of cortisol. If you are relaxed, like what I usually ask my patients, relaxed, and in the morning get the blood test done. Usually, if it's accurate, it is kind of accurate, but the saliva test will be more accurate. The reason being, when you do a blood testing, usually when you have somebody poke you, it will. The act of just getting blood testing. The act of getting blood testing will stress some people out. So when you're stressed out, cortisol kind of goes into fight or flight mode, and it gets elevated falsely. So when we're trying to figure out things as far as fatigue, something called adrenal fatigue by Robert Wilson, and it's a disease process that most of my naturopaths will follow, but most of my endocrinologists and doctors kind of question. I think it's valid, but one of the best ways to figure that out is to get a salivary cortisol. If your saliva cortisol shows that it's low, then you probably have it, in addition to the symptoms. So back to the reason for getting blood tests. If it's covered by insurance, I'd say get it. But if it's not covered by insurance, then we can do these blood tests to figure out, again, your basic level in the morning. If you get a blood test in the morning and it's low and you're my patient, then it's worth it to try to fix things. And usually the first thing I do with fixing things is work on sleep, work on relaxation technique, things. And then after about a month to 6 weeks, redo the blood test. But most people will usually feel that it is improved as far as energy level and sleep disorder by them. Bottom line is, when we test for cortisol, if it's covered by insurance, I'll get the salivary test. If it's not covered by insurance, I would usually say this is good enough. I happen to have somebody who works in the office, Yolanda, who's really good, and I didn't feel that. And most likely my patients don't feel the needle stick, but some of my anxious guys or some folks who are really nervous, again, it'll jack up the cortisol level and it'll give you a false reading. But I can usually work with that and figure things out. Thanks, Don. So that is why I do cortisols, and that's how I start the workup as far as fatigue, sleep disorder,